My name is Lena and I'm with CVSKL consultant, physician and nephrologist, Dr. Jeyabalan. Hi doctor, how are you?
Hi, fine.
Thank you so much for doing this, for answering our questions. So doctor, we posted on our social media of what to ask you. So let's get the obvious question out of the way. What is a kidney specialist doing at a heart center? What's the connection? Kidney and heart.
Okay. First of all, patients don't come just with heart problems. They often have diabetes, kidney problems, all sorts of other problems together, because all these chronic illnesses, they are all related. And many patients with heart conditions, the heart does affect the kidneys and the kidneys do affect the heart. So especially after a cardiac bypass, the heart struggles and it start to affect the kidney. The patient can go into kidney failure. They need dialysis support. So the cardiologists and nephrologists virtually need each other virtually to take care of cardiac patients, and that's the reason why I'm here.
Okay, doctor, how common is kidney failure in Malaysia?
Okay. I think kidney failure, it is important to know there are two major forms of kidney failure. One is called acute kidney failure and the other one is called chronic kidney failure. Acute kidney failure is most of the time temporary. It comes when you're sick with certain illnesses. You may need some dialysis support, but in most cases it will resolve. What most patients, when most people, when they ask for kidney failure, they are thinking about people going for dialysis for the rest of their life. That's called chronic kidney failure. So chronic kidney failure, if not taken care well or not diagnosed early enough, can lead to complete failure of the kidneys, what we call end-stage kidney failure, and that's the one that people end up doing dialysis. And we have about 50,000 patients on dialysis right now in Malaysia, and every year about 10,000 new cases are being diagnosed. A large number of them due from diabetes. So it's quite a big number for a small country like ours. So chronic kidney failure is an important illness, and it takes a lot of resources from healthcare, from both the private and the government side.
So if a patient is diagnosed with a chronic kidney failure, can they go on without dialysis? Is it possible?
Okay. Chronic kidney failure, that depends on which stage of the chronic kidney failure. For the nephrologist, we classify chronic kidney failure in 5 stages. Stage 1 being the very early stage, to stage 5 being the stage where you need dialysis or transplantation. So if you are diagnosed as, say, stage 1, stage 2 or perhaps stage 3, it is possible to treat the condition so that it doesn't progress on to stage 4, stage 5. Okay? But the problem with chronic kidney failure is symptoms often come very late. So symptoms like vomiting, poor appetite, shortness of breath, weight loss, they always come usually at about stage 4, stage 5. And at that time, it's often a lot of damage has already occurred to the kidney. The kidney has become scarred from the illness that is shrunk already. So it's often difficult to reverse the condition at that point. So at that point, if you're diagnosed, like many patients are, it's almost always going to need dialysis or transplantation. But if you pick the patients up at stage 1, stage 2, stage 3, at that point, there's usually no symptoms. So if you do not do your tests, okay, urine test, blood test, you're not going to pick up a patient with stage 1, stage 2 or stage 3 chronic kidney disease. So, and that's the time, the golden time, that you can actually do something to prevent the patient ending up on dialysis. So regular medical checkup, especially for people who are susceptible or at risk of getting kidney failure like diabetics, early and for regular medical checkups may pick them up early enough that we can actually prevent people going on to end-stage kidney failure.
Okay, you said earlier there are no symptoms for chronic kidney failure, right?
At the early stage.
At the early stage.
Yeah.
Okay, so before the patient goes on to any stage, so how can they detect whether the kidney is healthy or is slowly damaging?
Okay. Sometimes you may get some early symptoms like bubbles in the urine. When you pass urine, you get a lot of bubbles in the urine. That normally indicates protein leakage in the urine. So sometimes you are lucky, you may get some symptoms like that, or in a younger person who gets diagnosed with hypertension, those below the age of 30 will get diagnosed with hypertension. That could be indicative that you may have some form of chronic kidney disease. But in many cases, you don't really get any signs and symptoms. So without doing urine tests and blood tests, you're not going to diagnose chronic kidney disease in majority of patients. In fact, in many conditions, the urine starts showing changes long before the blood test even starts to deteriorate. So proteins in the urine, blood in the urine, they are often very, very early signs of early kidney disease. And if you are you pick it up at a time, you can pick up at the stage 1 or stage 2. You can work up the cause of the kidney problem and treat that so that it doesn't progress on to dialysis and stuff. So in most cases, unless you do regular blood and urine tests, you probably are not going to know that you have got early kidney disease.
Okay, so what is actually the kidney's worst enemy? Is there like a certain food that we cannot eat to prevent this from happening, or other things?
Okay, it all depends on what causes kidney failure, chronic kidney failure, and in majority of countries, including ours, the number one cause is diabetes. 40% of our dialysis population are on dialysis because of long-standing diabetes. So if you are diabetic, obviously, you have to control your diet in terms of sugar, carbohydrate intake, and make sure the sugars are controlled. And also, despite control, you still can get kidney problems. So you need to make sure that your kidneys are regularly monitored for early signs, so that you can treat it at that time rather than wait for the kidneys to be permanently damaged before you do something. So on the other hand, if you've got, let's say, people who develop stones get kidney failure, then that's because one of the reasons will be maybe you're not drinking enough water. Because Malaysia is a hot country, you tend to sweat a lot, our urine tends to be concentrated. So we know renal stones are more common in the tropics compared to European countries or the temperate countries. So drinking a lot of water may help reduce your risk of getting kidney failure from stones. So it's not so much the kind of food, but what kind of illness you're trying to prevent. But many people probably have heard about this relationship between protein intake and chronic kidney failure. So in people with stage 3 chronic kidney failure onwards, there's evidence that reducing protein intake, that means meat, fish, soya, those kind of protein intake, we often most of these patients are prescribed a low protein diet because protein intake can further, there is evidence that it can damage the kidney further. But this is only in people who have already developed significant kidney disease. But there's no evidence that you take a lot of proteins for the normal kidneys is going to lead to kidney failure. So it's more diabetes and controlling those kind of things than your normal food you're taking that's going to damage your kidneys.
But we still have to watch out the amount of meat we take and fish.
Anything in excess is bad. So obviously, you even take a lot of rice, it's going to be bad for you. Taking a lot of fat rice, so everything should be taken in moderation as you're recommended for your weight. But in terms of specifically for the kidneys, the normal food that you take are generally quite safe.
Okay, so the next question is, can renal failure cause a heart attack?
When you say heart attack, it usually means a blocked artery causing blood flow to cease in the heart, a portion of the heart, and the heart muscle then dying because lack of oxygen. That's called heart attack. So you get chest pains and kind of thing. So renal failure can predispose to an increased risk of getting coronary artery disease and heart attacks because the poisons are not being cleared. They contribute to damage to the arteries, including the arteries that supply the heart. So you can get what you call an accelerated atherosclerosis. Atherosclerosis is the main pathology that leads to blocked arteries and heart attacks. So a person with serious kidney disease have an increased risk. In fact, the commonest cause of death among patients with advanced kidney failure is heart attacks, called a heart disease. Okay, but there are also other forms of heart disease that are associated with kidney disease. Again, more in terms of more advanced kidney disease, chronic kidney disease, because many patients with kidney disease, they may not be passing enough urine, and they tend to get a lot of urinary water retention, and water retention then causes the heart to enlarge and weaken the heart. And many patients with chronic kidney disease also develop hypertension, high blood pressure, and high blood pressure in chronic kidney disease can often be difficult to control despite medications, and high blood pressure again is going to have a negative effect on the heart, and that's why I said kidney disease and heart disease are interrelated. So not directly cause a heart attack, but because of the changes in the processes in the body, it can increase your risk of getting heart attack and heart disease.
If a patient already have been diagnosed with heart failure plus chronic kidney disease, I'm sure that patient have to take a lot of medication, painkillers and other drugs. So will taking a lot of these medications affect the kidney?
Okay. The one is not accurate. They don't have to take a lot of painkillers. You mentioned painkillers. Okay, you don't need painkillers for heart disease, heart failure, kidney disease. When the heart fails, it's going to further worsen the kidney's condition. So it's the worst case scenario is actually have both the kidney and heart failing. So in fact, some people call it the cardiorenal system, because the heart and kidneys are often looked at as one single system. So if both systems are failed, then you're going to get worse kidney disease and worse heart disease. So that itself is a risk for the kidney itself, because now you've got a weak heart that's not going to be able to help the kidney out, and similarly you've got a weak kidney that's going to be able to help the heart out there. So drugs can become a problem, but here the condition itself will be more dangerous for the kidney than the drugs. But any drugs that we are going to prescribe there, especially some cardiac drugs, can often also affect the kidneys. But it's not a problem, and we work closely together with the cardiologist and nephrologist, and as long as we monitor the kidney function, we often can get away with using some of these drugs, because sometimes the drug is very, very important for the heart, but we know it can also affect the kidney negatively. But on the other hand, if the heart improves, eventually it will also help the kidneys. So it doesn't mean that it can be bad for the kidneys that we don't often use. But important thing is be monitored, and as long as the doctors know what they're doing and in consultation with each other, many times be done. But you as a lay person, you should not be taking any just drugs over the farm counter or pharmacies and all. That's when you run into trouble. So as long as you know what you're doing and the doctor prescribes and monitors accordingly, it's not a problem.
Okay, some patients may not believe in modern medication, and they opt for traditional medicine. So, what do you think about that? Can it be substitute?
The problem with traditional medications is, again, many people have the wrong belief that traditional medications must be safe because they are natural, okay? Which is not true, okay? Because many of our drugs that we use are actually purified from natural sources. It's just that the same drug in the plant is now being purified and we make it a pill by the same substance. So whatever is inside many of these traditional medications are very similar to drugs we are already using, and if our drugs can cause side effects, so can the traditional medications. And we have, in fact, most textbooks of nephrology nowadays dedicate one whole chapter just dedicated to the all sorts of kidney disease that have come about because of the increased use of traditional medications. And just to quote an example, in the 1990s in Belgium, they were puzzled why a lot of young ladies were going to permanent kidney failure, needing dialysis for life. And when they looked back, these ladies were taking Chinese tea, which was supposed to help you lose weight, but it contained this chemical inside there that when you went to the kidney tubules, it crystallized and scarred the kidney for life. So it was traditional tea, and that led to kidney failure. And I think people are also aware, but 10 years back, what this case in Singapore where it's not kidney, it was a liver that failed after this in Singapore actress took some herbs to lose weight. Again, the liver failed in this situation. So it's a policy to say traditional medications are safe. Okay, they are can be equally as harmful, even some of our medications. The main difference for me is, as a practitioner of Western medicine, is most of the time when we prescribe drugs, even though we know it can cause side effects, at least we know what side effects to look out for and what to monitor. Whereas when you're taking traditional medication, you really do not know what kind of side effects you're going to get and whether everyone's going to react similarly and even what sort of benefits you're going to get. So in a way, you're taking a bit of like a lottery because we do not know what you're going to get.
Okay, doctor, but we are living in a world where, because I myself want to look pretty, I do buy in all this ads sometimes, if you buy this product, you will look fair and everything. And they sell this over the counters. So, are there any certain ingredients that we should look out for? Like, okay, once we see the ingredient, we know this ingredient is dangerous. So, can you advise us on that? Or we shouldn't be taking that at all?
Okay, the basic fact is the moment you take a substance and put in your mouth and swallow it, it is always going to have a potential to be harmful to anyone. Okay, and because when talking about drugs or substances, in relation to harming the kidney, there are two mechanisms. Okay, one is example like painkillers. The very nature the painkiller works. Any one of us, all of us, if we take painkillers in sufficiently large enough amounts, it will damage our kidney because that's the way it works. But there's a second mechanism by which what you call an idiosyncratic reaction. That means it only reacts that way to you and not to another person. So when you take something inside, for you, your body may react in such a way and damage your kidney. Another person, it may not. So every time you take a substance and you put inside, you are exposing yourself to such risks. Okay, and the same goes for all these kind of health supplements. Okay, and the main thing is also sometimes you have no choice. You are taking the drugs to make yourself, you can cure yourself. But you're taking supplements. Many of these times there's no proof is going to even help you. So you're taking a risk on potential adverse effects without a guarantee that it's going to actually make you better. And don't forget, almost all these kind of substances will have preservatives inside. The substance may be okay, but the preservatives may be harmful to you. So basically, whenever you take all these kind of substances, most of these there's no evidence that they are actually helpful, but you are increasing your risk of harm to yourself.
Okay, so doctor, any advice to your patients or to the viewers who are watching?
Yeah, I think we often see, unfortunately, we're still seeing patients getting admitted, vomiting and breathless, and suddenly coming after 1 week, breathlessness, and come to hospital and tell them your kidneys are gone, you need dialysis, and they say, I never knew I had kidney problems, because they didn't know they had kidney problems. Okay, because this process, but I tell them this process didn't start last week, it didn't start last month, it's been going on for years. But because nobody checked their kidneys, they didn't go for medical checkups, they did not know the kidney was already failed. Or sometimes we look at the records, say, 10 years back your urine had some proteins, but nobody told you about it. So at that time, you could have done something to prevent. So in other words, early detection is the only way currently we have to prevent people from ending up on dialysis. We have no real good medications. Once your kidneys are at stage 4 or stage 5, the best at stage 4, even stage 3 sometimes, the best we can hope for is to delay the inevitable. So it's a shame because many of these conditions can have been prevented if it was picked up early enough. But because you don't have any symptoms, okay? So I think the most important message is chronic kidney disease often do not present with symptoms until it's very, very advanced at stage 3, stage 4. Only then, by which time you may have missed the boat to treat the condition. So it is quite makes sense to at least once a year or so, or even more often if you are at risk, for example, a diabetic. If you're not at risk, the general population, at least once a year, checking your urine and your blood to pick for early signs of trouble. I think that makes a lot of sense.
Okay, Dr. Jeya, thank you so much for answering all the questions. It's been very helpful.
Okay, thank you for inviting me over.
Thank you for watching, and I hope you like this video. So don't forget to like and follow us on our social media, and stay tuned for more videos like this. Thank you.